to our first Students with Social Prescribing podcast. So let's start off with introductions. My name is Shuhari. I'm the founder and chair of Students with Social Prescribing. Opposite of me is...
Yes, I am Arthur. I am the co-chair of S4SP. It's a pleasure to have you all here. And today we welcome Dr. Ramy.
Thank you guys for having me. I mean, it's very exciting, the work that you guys are doing.
The privilege is ours.
Yeah, no, I mean, it's good work that you guys are doing, and thank you for thinking of me and reaching out to me. I mean, for those of you who are watching this podcast, I highly recommend you follow these guys.
Thank you.
Myself, my name is Ramy. I'm a physician. My background is internal medicine. I was born and raised in this country. I lived in this country for about 30 years. And my work has been around internal medicine, digital health transformation and innovation. And I work also on governance of AI. But in the last few months, or in the last year specifically, I try to harness all the experience that I have to deliver on the things that I'm passionate about, which is mental health, wellness, and fitness, for personal reasons, but also for reasons that are related to how basically our society functions. So that's me in a nutshell, and maybe that's a good segue to what you guys are trying to do and raise awareness about.
Yeah, I mean, our core aim at the center of S4SP is obviously to raise awareness for social prescribing and just develop networks where we could potentially then integrate or even launch a pilot program in social prescribing. I mean, the Middle East as a whole has everything, and it's kind of ready for social prescribing. In terms, we have other social prescribing adjacent activities like Fitness Week that runs in Dubai. I know we have something called the Walk in Yas Marina Circuit.
There's even 30-30 for October.
Yeah, 30-30. Essentially, we do have the activities, or we have the community-based activities that require social prescribing, and it's kind of primed and ready for integration. But for some mysterious reason that not many physicians, first of all, even know what social prescribing is. They might know maybe the activities that it entails, maybe dieting or therapy in a way. That's what caught my eye initially when I was searching on who to interview or who could be a good candidate. Is your article stood out as, I think it was the only one on LinkedIn or on social media for that matter that talked about social prescribing, specifically in the Middle East. How did that come about? How did you come across social prescribing?
Honestly, it's like I said, it's my passion. I've always been passionate about keeping fit and keeping healthy, and it's for pragmatic reasons, so that you can go on with your life and function effectively. But what kind of triggered that article maybe is, and this is a bit of a promotion of this leadership network that I'm part of. It's called the Dubai Science Park Leadership Network. And the leader of that network, he's a great guy. His name is Marwan Janahi. He is the senior vice president of Dubai Science Park Network. Wow. And he part of the activities that we do in that network was a hiking activity. And I've never done hiking before. I've always been into almost like medium to high intensity sports. So I play football, I play tennis, I even did some martial arts before I got badly injured. But and I never thought that I would enjoy something like hiking. And I found that there are lots of benefits from it, and it fits very well into that definition of what social prescribing is. First of all, you get to spend time with people. You climb against an elevation, so your heart rate actually goes up. And but despite that, you can still have conversations with people, and you still get to meet people. So it has that element of a social element to it, plus an element of being outdoors, plus an element of maybe some kind of physical activity. And it's not easy. As the elevation gets steeper, it's not easy. And I totally underestimated it. But I ended up enjoying it. These same, let's say, parameters apply to another sport that is very popular in the world, which is football, for the exact same reasons, because it promotes basically being in a social setting. It promotes teamwork. Obviously, you do some physical activity, and maybe that's what social prescribing is about. It's not about complicating what the definition is, but there is, of course, a technical definition in the context of healthcare delivery and maybe in the context of medicine. But in the context of healthcare delivery specifically, yeah.
Definitely, and I think you raised on you put underlined the really important point here: communication and teamwork, and like the basis of people talking to each other as a real form of treatment, and living life as us humans. And I think in the UAE, it's quite essential that we talk about that because the how families form here, how the gatherings, the traditional way of living around the majlis and everything.
100%.
It's all around communication, all around human connection. So I mean, looking at that. What factors would you say makes the UAE more uniquely positioned compared to any other regions for like the advantages that social prescribing can bring?
Yes. Well, you can go and read the article if you want to know more, but in a nutshell, and I think this is an advantage that we have in this part of the world and in the UAE, yes, summer is a little bit unbearable outdoors, but for 7 months of the year, we have amazing weather, and this promotes outdoors activities. Not to mention that even in the summer, when it gets really hot outside, there are things that you still can do in that social setting, even within mall settings, within indoors sports venues such as the Dubai Sports World and other venues. So, and I think this all comes down from the leadership and the government policies and the government's initiatives to basically promote that kind of like social well-being in the society, not just for its citizens, but also for the residents of the country. So lots of check boxes for why the UAE is really suitable for social prescribing.
I would also add on that I guess the general trend after COVID was non-communicable diseases, so maybe depression or anxiety, whatever it may be, has risen sharply. If I guess in the teenage population mostly too, not just combining the exam stress, but social stresses too. And I think social prescribing could be valuable in helping each other. At the same time, they could pick up useful and even healthy activities like, I don't know, playing football or just talking to each other, having group sessions.
And I think you're particularly going to be interested about this, especially in your keenness towards mental health. So what would be your opinion on social prescribing and how it could affect, for example, like the treatment per se of mental health issues?
Well, honestly, this is not my opinion. This is all backed by evidence, and it's backed by a lot of research. And maybe this is just to clarify what social prescribing is in the context of healthcare, because social prescribing entails actually being outdoors or doing some kind of activity, and for that to be prescribed by a physician and for it to be paid by the payer. So obviously how the healthcare system works is that there are different stakeholders. Obviously there are patients that all the other stakeholders are supposed to serve, but then there are the providers, which has the patients. There are the payers, which could be government entities, it could be the insurance companies, and of course there's the regulator, and then there's the pharma and the life sciences industry. The problem, or not the problem, but the challenge of why social prescribing is not picking up, for example, because to this point it's considered to this day it's considered a qualitative measure, and it's hard to quantify qualitative measures. And to put it in very simple terms, it's challenging to also pay for it or reimburse it. So, I mean, when you put it in very simple terms, that might sound counterintuitive. For example, no insurance company, and I've heard this conversation before, is going to pay for a yoga session, let's say, or they're going to pay for a day at the spa. Even though those things, they fall under that umbrella of social prescribing. But like I said, there's a ton of evidence behind it, and there is an increased awareness towards that, towards that approach, which might not necessarily be mentioned explicitly as social prescribing. But that approach of promoting social activities, outdoors activities, wellness and fitness, all of that falls under that category.
And and even, you know, like looking at that and looking at the qualitative versus quantitative measure, what would you say is the most outcome efficient framework that we could use and that maybe you use through your research into this and delving inside the topic of social prescribing? What way could we, or like as a society, look for quantitative data in social prescribing?
Just to add on that too is I think it's much easier to maybe measure the financial standpoint, or like we said, quantitative. It's very easy to measure the numbers, but when it comes to maybe people's feelings or their outcomes, more looking at a mental in a mental perspective, I guess it's much harder, as some people struggle to define, first of all, maybe their feelings or their outcomes. But is there a better way?
No, it's not essentially about only feelings, and there are efforts to let's say quantify qualitative measures. There are efforts to do that, and there are ways to do that, and there are metrics that are called, let's say, DALYs and QALYs. These are things that we use in population health, but they haven't been formally pushed to be integrated in conventional reimbursement systems. That is the issue. And because, like you said, the ROI, or the return of investment, is not clear. And this, I mean, it's not me going at a tangent, but this goes back to another problem that I'm also passionate about and I'm trying to solve, and it's the abundance or the availability of data. So I'm a fellow of the American College of Healthcare Data Management, and at the root of everything that we do, including artificial intelligence, you must read this. Without good data, you're not going to have good outcomes. Yeah. And the same applies to, let's say, social prescribing or the ROI from social prescribing. If you don't have data, at least historical data, you can't compare it with modern day data or present data, or even predict future data and compare and try to quantify if you have prevented a certain medical condition from happening, if you've prevented visits to outpatient clinics or primary care clinics, or even emergency medicine, or even emergency departments. So, and that's why the data is needed. But you need to start somewhere, and you know, there is increased awareness about it. The regulators are definitely on top of it, and there are policies that are addressing these issues in terms of data collection, and in terms of also promoting what could be classified as social prescribing. The quality of care is a top priority for all regulators here throughout the 7 Emirates of the UAE. And what's best for the patient, whether it's high quality care, whether it's high quality community initiatives, and we see those community initiatives driven by the highest leadership. So yeah, I agree with you in that space, and maybe to reassure you guys, it is just a matter of time.
Yeah, you know, I think reassurance is maybe not what we're trying to go for, you know, for our viewers, but mostly like trying to advocate for the matter of time, you know, because why force the bottleneck when we could, you know, come ahead of time and implement
100%. Be prepared for it, and there's no harm in raising awareness for it. I mean, that's the first step. I don't know if you know the
just getting the message out there. I think would be the most important.
Getting the message out there, getting people to know that actually there are measures that you can do that might not cost you even a single dirham.
Yeah.
And it will benefit your mental health, your physical health, even your social life. So yeah.
Social media obviously is a very important part. You know, LinkedIn, Instagram, just getting out the message to younger audience, I think, and breaking the stigma that maybe surrounds mental health or getting help for that. Yeah. And another thing I did want to touch on was, obviously, depending on the healthcare setting or on the country, the implementation of social prescribing changes. So in the UK, you obviously have the link worker system, where quoting from Dr. Bogdan, you know, he's the clinical and global lead of NASP. What he told me was physicians in the NHS, especially GPs, as we stated before, they have time constraints, and appointment issues or scheduling is a big thing. So they often don't have the time to assess the patient's needs and prescribe them specific community activities. That's why they hand them off to specialized workers, so link workers that evaluate them and give them specific activities. But you also have mostly in initial settings where the doctor itself evaluates the patient, prescribes the activities directly without involving link workers. What model do you think would work best here?
I think it could be it's just the reality of things. It's not bad or good or right or wrong, but from my experience at least, and I could be biased, but patients, they trust their doctors, and patients have a loyalty to their treating doctor. If a doctor treats them well, and they have a good experience with that doctor, they will follow that doctor wherever they go, regardless of the organization that doctor in. In fact, that has become almost a requirement that doctors, need to have a certain, it's almost like social media followers. But yeah, there is the connection of patients here is very strong with their doctors. So I think the doctors will be the primary drivers of this. That's not to say that other healthcare professionals or other professionals in the healthcare system don't have a role to play here. Of course they do. But I'm a physician, so maybe I'm biased, but I believe that physicians need to lead these initiatives, especially if they're related to their patients' health and well-being.
I think that's why we push for building networks, especially with physicians, because we do regularly have a conversation within the team or even with Dr. Bogdan, asking who should we focus on, maybe students, or do we focus on doctors or physicians? And I always advocate for the fact that, yes, students can involve change within their own community quite well, as everyone knows everyone these days, especially in the UAE. I think that's something unique that we have is we are a community, especially if you would probably, or everyone would know everyone in their own building and kind of have at a certain level of friendship with everyone. So they can drive change within the community. But what I always advocate for is physicians and the doctors should always be the front runners, as not only are they enabled by their clinics, they can reach out to patients, but they can bring a more meaningful impact in the beginning, while students can raise awareness a bit more better.
100%.
I mean, did you want to say
maybe
something?
definitely. And maybe redirecting a question for you. What do you think that are the doctors doing right now, or the highest level of governments doing right now in the ideas following social prescribing or following holistic care? Could you cite any examples of regulations or movement towards this that the UAE is doing already?
Yeah, so obviously on the federal level, there is a national well-being policy for 2031. And that's a policy that's planned to promote all these things that we talked about, community-based activities, and they even, if I remember correctly, I read the draft maybe a few months ago, but it was 3 layers. It started with the individual, and then the society, and then the government. And these are the 3 layers where, and maybe here I'm going to quote, or I'm going to put on my population health hat. There's a model that's called the Dahlgren-Whitehead model, which talks about the social determinants of health. And this policy basically addresses those social determinants of health, which are the layers that surround the individual. You start at the individual at the core, and then you go out into their lifestyle factors, and then you go into their work environment, their communities, their societies, and then obviously the macroeconomic and socioeconomic factors. So addressing all of this is one of the policies that addresses that for 2031. There is the Dubai Health Authority mental wealth policy, and I like that name a lot. It's not mental health, it's mental wealth, and it's if I remember correctly, it's already out there. And again, it addresses all these issues that we know are challenges for seeking mental health, whether it's stigma, whether it's taboos, whether it's access to care. And it promotes, but it promotes a more, let's say, safeguarded approach to that, because also, you've spoken about social media. There are a lot of there's a lot of people who go on social media and they give wrong advice, wrong health advice, wrong wellness advice, And so here specifically in the UAE, that's absolutely frowned upon. So it's actually illegal if you're not, let's say, if you're not a licensed psychologist or psychiatrist, you're not allowed to post content on social media regarding mental health. And that's something that I'm a big advocate of.
Yeah, and another thing I would add, especially in Abu Dhabi, where I live, is social well-being is built into the community or in the structure itself.
That's another policy.
Specifically looking at parks, let's say, usually it's a place where communities would get together, play sports. And off the top of my head, I would say every block in Abu Dhabi would have at least one park.
Yeah.
So maybe in a 2-kilometer radius or even a 1-kilometer radius, I have access to 3 parks, Corniche and all these other things with fully clean, funded football pitches, basketball pitches, all these things. So I guess our leaders, the leaders of the UAE, have realized early on that parks are an essential part of maintaining mental health. And I guess...
So in population health, we call this health promotion, where you basically work on the infrastructure, you provide all the amenities, and it's even almost like just a regulatory requirement when a community is being commissioned and when a community is built. It needs to have amenities, it needs to have public amenities, it needs to have a clinic, needs to have a mosque, needs to have all of these, and that's what's like you said, it's great about this country. I grew up in Abu Dhabi, so I know exactly what you're talking about, but obviously this is also being applied in Dubai.
Yeah. And maybe looking forward into social prescribing, where do you see social prescribing helping the most? Maybe like looking at what the plan for this 2031 healthcare reform that the UAE is trying to implement. Do you see mostly help social prescribing helping in youth mental health, chronic disease management, or more towards preventive health? Where do you see it, and where do you think the UAE would go to?
I wouldn't pick one, but I would just.
Oh no, of course, I'm just saying. Like,
I would prioritize, to be honest. And if I had to prioritize, I would prioritize chronic diseases because they cost the most. They cost the healthcare system the most. So I would prioritize chronic diseases, and then I would prioritize, obviously. I mean, I don't think you actually also need to, or we have to prioritize. They can all be addressed in parallel.
Yeah, of course, it's not one more important than the other.
Exactly.
It's just,
they all can be addressed in parallel and through different approaches. Chronic diseases, unfortunately, though, there's the pharma component to it. So there's the medication component to it. So it costs a little bit more, and that's where maybe a little bit more focus is on it, just to dedicate budgets to it and to dedicate resources to it. But I think they're all equally important.
On the topic of charity networks, obviously charities will play or have to play an essential part when it comes to social prescribing, or a government agency is possible too. But if we look at the NASP model or the UK model, charities play an essential role as well as the government, but it's mainly charity driven as they're the ones who are providing the community-based services. So how exactly can we see a way forward in terms of, I would say now charities are more geared towards providing maybe food or shelter or maybe even cash.
The Ramadan drives, for example, I think is a big example.
But not, I would say not many charities exist out there that might say, let's do speech therapy classes or let's do befriending groups. How do you think charities could potentially build those activities and provide them to the community?
That's a good question, to be honest, and I never thought about it. I never thought about, for a few reasons, I never thought about charity getting into healthcare in general, because healthcare is a fundamental right of every individual. So there's always an allocation of government budgets, payer budgets, whatever, to individual health. I have no answer to that, to be honest. I don't know how charities can help. Obviously, charities can help by raising awareness. These individual approaches, they can obviously contribute to the bigger mission of raising awareness to social prescribing. But and this is me also trying to manage my bias as well, because subconsciously you'd think of people who need social prescribing are not necessarily suffering as much as people who are short on food and shelter.
Yeah.
So I, but this is again me just managing my bias. But I'd rather if charity focuses on those people, and then for social prescribing, you can have, let's say, people like you, communities in schools, and even amongst healthcare professionals, and it doesn't cost anything.
Yeah.
It just costs a 30-minute walk in parks that are available, or a run on a running pathway that we have again available for free on beaches, and even workout equipment is available in public. So there are no excuses, to be honest. But when it comes to charity, I'd rather have them do the more important, not the more important. This is still important. But I'd rather focus on that, where
the
for
core
people,
aspect.
the core aspect of of their missions, to be honest.
And Arthur. And sorry for interrupting, but just another thing I would add on to that is, what could potentially be the use or the effect that international organizations dedicated to social prescribing, like the NASP or the SPUSA, could influence not necessarily the government, but obviously, yes, they can influence the government, but also community-wise, how can they help implement it in a shorter time span then too?
So international organizations, obviously, and it's just a reality of things. This part of the world is still young in terms of data maturity, in terms of research maturity, in terms of guidelines maturity. So we take a lot of things from international and from reputable organizations in the West. And we don't have a problem with that. In fact, this is something that I admire about the leadership here, is that they're not keen on reinventing the wheel. They take whatever works from playbooks that work, and then they adapt it and they customize it to the region. So in terms of international organizations, 100% they have a role. These collaborations, there's knowledge transfer, and obviously the frameworks that these organizations use, because you can't just simply put, you can't copy and paste, because the contexts here are a bit different. But you can take the frameworks, apply the same principles here, and tailor it to the requirements here. So of course they have a role. I don't know if you guys know in project management what is known as the RACI matrix. It's like when you classify stakeholders based on the role. So R is responsible, A is accountable, C is consulted, and I is informed. I think international organizations can be consulted, and of course local organizations and governments, of course, these are the ones who are responsible and accountable for the implementation.
Yeah, my question was simply put, if we talk about resistance that we might face as a community, how do you think would patients react, or like our viewers when they become patients? I mean, praying on wood, but when we all go to the doctor, how do you think we might react, or how the doctors might react when faced with implementing social prescribing?
So, I mean, we call this hesitancy of adoption, and you see it with anything that's novel, whether it's technology, whether it's a new methodology, whether it's even a new kind of food even. So this is normal in human behavior. That said, and this is my thesis, is that it's generational. So the younger the generation, the easier it is to convince them with these things that are a bit more sustainable, that are a bit more, for the lack of choice, for a better word, they're a little bit more ethical, they're a little bit more, conscious about the self. Older generations, and I'm part of those. These generations were heavy consumers of everything. They were heavy consumers of resources, heavy consumers of food, heavy consumers of... So, but I'm again biased to my generation. I'm a millennial, and we've seen that transition. We've witnessed the first, let's say, as an example of extrapolation, we've witnessed the first flip phone. We've witnessed the first touch phone. We've witnessed, and we're still seeing it. So my generation is a bit split. People are still nostalgic about the past, but there's a generation that's very much accepting to things that are happening. And as the generations go by, this is my thesis, it'll be easier to change, to have that change management.
And I would say I think we've made huge strides when it comes to mental health or just mental health
100%.
awareness. I get a few years, not necessarily a few decades back, I would say, and especially I would say India or Asia as a whole, mental health stigma was a real thing. Back then, I mean, if you went to a psychologist, they would think you were crazy.
Yeah.
But I guess as we move into the modern world and everyone faces
Yes.
anxiety or pressure, if it be school, if it be work, whatever it may be, I guess they've learned to ask and reach out for help, and just accepted that mental health is as important as physical health too. Then.
100%. And this is why awareness is very important. So what you guys are doing is great, because when you put it out there, people will say, oh, hey, those guys, they're talking about something that makes actually sense. You know, I don't need to go into a doctor's office and always leave with a bag of medicine. I don't need that. If I don't need it, I don't need it. So, and that's the mindset that I'm sure maybe you guys are referring to, is that patients or I don't like to use the term patients, because I've said this before, to me, individuals are healthy until proved otherwise. But there's always an expectation when you go into a healthcare facility, like a hospital or a clinic, there's an expectation that when you go in, you need to leave with something that you can carry, that you can hold. And like, for example, in the NHS, they give them leaflets if they don't give them medication. But in here, people are almost always conditioned to have medication, and they get a bit disappointed if you don't prescribe them medicine. But that's, I think, but again, that's something that is changing. And again, the government is doing great work, and I'm not just saying that to butter up the government, but it is doing great work. You mentioned the 30 by 30 November Fitness Challenge. This is a great initiative that's raising awareness about how you just don't need much to exercise. All you need is 30 minutes, be outside, move, and it will solve a lot of your problems.
Yeah. And I would say, I guess we'll finish off here, is social prescribing. I think what's unique, and Dr. Bogdan always preaches this to anyone he speaks to, is what we like to think of social prescribing as pills they may solve your symptoms. So let's say if you have asthma and you take albuterol, then yes, your asthma won't be there. But maybe social prescribing might fix what's causing your asthma in the first place. If that is your house being damp, or if it has mold, that naturally causes you asthma. And this is actually a real patient case study that he told us about. Was one of his patients kept coming into the ER with asthma attacks. Yes, he prescribed him albuterol, ran all the tests. So he's done to the extent what clinicians can do. But once you have a deeper talk and maybe spend 10 minutes with the patient talking about their household, only then do you find out that they have mold or their house is damp due to whatever faulty insulation, whatever it may be. So then £100 check may save them £1,000 in the future, or may just save them tens of hospital visits and suffering then.
Well, I mean, it's a good example, obviously, and I think it's a bit of an oversimplification, but it's a good example, and you are absolutely right in terms of, like, social prescribing can address the root causes of issues, and they can prevent them from being aggravated, or from being exaggerated, or from reaching the point where you actually need a medical intervention. But yes, they do address the root cause, and again, this is where awareness is really important. It's important for people to know or to recognize when they can, because most of the time you don't know. Most of the time, people don't know until the symptoms appear. They don't know what to do until the symptoms appear, and then when the symptoms appear, they go to the doctor, and the doctor's like, "Oh, you should have done this or done that, or here's a medicine that will help you." But that's why awareness is important, and I guess it's up to you guys to also, and this is very important, to quantify that qualitative return. how can you quantify that? And
to be fair, we're working on many projects in the future, to working about that, and in the community aspect of that.
Yes.
I guess going out to the community, and one thing we're trying to focus on now is going out to the community and asking them, how can we help? What can be provided? Just getting that both quantitative and qualitative data, so that later on, when it does come time for implementation, they know what to implement, how to do it, and when to do it.
100%.
And I think that with that, I think it's a great conclusion for today. But firstly, I just want to thank you. We can thank you for your time so much. Honestly,
it
was a pleasure having you.
No, it was great.
And
it was great
talking to you. With your knowledge, with your breadth of experience, it's wonderful to have a perspective like yours over a project like ours. So thank you so much for your time. It was wonderful to have you. Thank you to our viewers who have been listening to us for this time.
And we'll see you in the next podcast.
We'll see you in the next podcast.